Those pelvic floor muscles have 5 main functions, and we can think of them as the 5 S's. So circulation, sexual function, stability, support, and sphincteric control, meaning, closing the sphincters of our urethra and our rectum. The pelvic floor muscles work to help control and make sure that we're not passing gas or losing stool or losing urine at certain times, but they're also there to ensure that our pelvis, our hips, our back all stay stable, as well as they're there as support for our bladder, our uterus if we have one, and our rectum. So they are there to also be the support for our organs, our vital organs.
Menopause has long been shrouded in secrecy, leaving many clueless, ashamed, and embarrassed to seek and extend support for one of the most natural transitions and rite of passage. Well, the spirit and mood have changed. People are surrendering to curiosity, knowledge, and empowerment. In this podcast, I'll share my own experiences and point of view, peek into the lifestyle and self-care practices of people experiencing menopause, and tap experts for their take on the pausal phase. This is for you if you are one of the millions of people in the menopausal phase or want to support them. I'm Dixie Lincoln Nichols, health and well-being educator and wellness founder. This is the Pause Pod.
Welcome, my friends. Today, I'm excited to have on the Pause Pod Dr. Melanie Llanes. She's a doctor of physical therapy and owner of Best Self Wellness, a pelvic health and orthopedic physical therapy clinic in Jersey City, New Jersey. While she treats all pelvic health conditions, her passion lies in the perinatal and menopausal space. She believes that every person deserves to feel their best self at whatever stage or transition they may be in their life. Melanie, welcome, and thank you so much for coming on to chat with me on the Pause Pod.
Thank you so much for having me, Dixie.
You are welcome. Okay, so share with us a pivotal moment in your life, or the pivotal moment in your life when you decided that you wanted to be a physical therapist and a pelvic floor physical therapist at that.
So I was doing my clinicals at a hospital for orthopedic, back pain, knee pain, things like that. And I met a pelvic floor physical therapist and was like, what is that? I've never heard of that. What is the pelvic floor? And it's crazy because I was in school for it, but we had never talked about it. And she just started talking about facts, lifestyle things that we can do as women to just start having more control of our continence, having more control of our GI system, and have a better sex life, right? And these are all things that I thought were my mind was blown at that moment. And I knew at that moment that that's what I wanted to do. And I wanted to spread that word.
I love that. So before we even go any further, talk to us about, some people may not be familiar with what the pelvic floor is and what the role of the pelvic floor is. So share with us so that people have some sense of understanding about what that is.
Yeah, for sure. So the pelvic floor are a set of muscles that are in both male and female bodies. So it's all sexes. So it's not just women. But those pelvic floor muscles have 5 main functions, and we can think of them as the 5 S's. And 5 S sounds, right? So circulation, sexual function, stability, support, and sphincteric control, meaning, closing the sphincters of our urethra and our rectum, right? So the pelvic floor muscles work to help control and make sure that we're not passing gas or losing stool or losing urine at certain times, but they're also there to ensure that our pelvis, our hips, our back all stay stable, as well as they're there as support for our bladder, our uterus if we have one, and our rectum. So they are there to also be the support for our organs, our vital organs.
Okay, so we're talking about menopause here and perimenopause, right? And how a healthy pelvic floor can be obtained, maintained, sustained during this time, because it's a big concern for so many people. What are some of the issues that women face as they move into the perimenopausal phase and postmenopausal phase as it pertains to their pelvic floor?
Yeah, absolutely. So when it comes to our pelvic floor, as we start to age, and even honestly, once we start hitting into our 30s, our estrogen levels, our progesterone levels, our testosterone levels start to fluctuate and change. And during that perimenopausal period is when our hormones just start decreasing. Then they'll kind of jump back up, right? So things just don't ever stay level as what they were back in our 20s, right? And in our prepubescent times. The problem when that starts to happen is that estrogen is such a protector for our muscles, including the pelvic floor muscles. And so when we have that reduction in estrogen, we start to have an atrophy of our pelvic floor muscles, which means that the muscles get thinner. So the thinness of those muscles, the less plumpness of those muscles can create weakness at the sphincters, meaning that you can release urine a little bit more frequently, so having that leakage. Or it can also cause dry vaginal dryness, which can cause pain during intercourse or any just pelvic exam in general. Or it can cause any sort of just pain in general at the vulvar region, the outside part of the vaginal area, or at the rectum because of all the nerves that are innervated into that area. So during that time, and then if you couple that, if they've ever had children in the past, if they have any scar tissue from any sort of past surgeries into that, all of that get exacerbated when your estrogen levels start to decline. So that's a big part that I'm always trying to work on with women in their perimenopause and menopausal state, is that every compensation that we had before, and you were able to live pain-free and leak-free with that, it starts to just come out more predominantly and more pronounced because now you don't have those protective mechanisms of estrogen. So now we have to look at everything lifestyle. We have to look at exercise. We have to look at muscle tension, things like that. Do we need to start taking some supplements to start creating a more healthy pelvic floor as well?
Got it. So who are the candidates for pelvic floor therapy? Because a lot of women in perimenopause, menopause, they may experience things like incontinence, painful sex, and they suffer through these issues and don't know what to do, don't know where to go, don't know who to turn to.
Everyone can actually really benefit, honestly. If you have a pelvic floor, you can come see me. You don't have to wait for symptoms.
Got it.
Those that can benefit are those who are all, obviously the ones that are going to come see me are the ones who have symptoms already, right? But you can benefit by seeing me before you have symptoms, so that we can work on what kind of lifestyle things that we can start to change and adjust so that we can promote a healthy pelvic floor. What is your toileting position? Are you having a bowel movement, putting a squatty potty underneath you or stools under your feet to help have a healthy pelvic floor? How's your core strength and your hip strength? We need to look at that because that is also going to help support your pelvic floor and reduce any compensation there. So we can start to do a lot of preventative measures and give you exercises to help coordinate your pelvic floor and make sure that it's nice and happy. Other things that I'm looking at is we're looking at your diet as well. I want to make sure that women are having a high protein diet, a high collagen diet, having adequate hydration, because all of that is going to be affecting how your pelvic floor is functioning and what's the health and status of your pelvic floor as well. And so all of that I'm looking at, as a preventative measure, but then also as a treatment if you do have symptoms as well. And then we're talking about also sex positions, right? What positions are going to be more comfortable for you so that you can enjoy and have an enjoyable sexual life, right? What tools can we utilize? There's definitely different tools that they have that can help stretch out your own pelvic floor that you don't need to see me. People are sometimes scared to come see me because they think that they're going to be with me forever. Right. And it's going to take 20 sessions or 6, 60 sessions. And my goal is not necessarily to cure you. My goal is to empower you. And my goal is to give you the tools that you need so that when symptoms arise, you know exactly what tool to pull out of your own toolbox and help yourself. And so maybe we go over like some vaginal dilators that you can utilize because now in your perimenopause, you're having pain with penetration. So here's a vaginal dilator. I'm going to utilize this, help stretch out my pelvic floor, reduce that pain. Or I'd say, here's some like certain creams you can try to use and make to ensure that you have lubrication as well as reduced dryness at the vaginal area. Here's some exercises you can do right before you decide to have intercourse to help relax the pelvic floor. Here's some breathing exercises you can do right before it. And this is how you even talk to your partner about how of what you need and how can you utilize your voice to help express your needs for during sexual intercourse.
I love this. And I have so many questions going through my head. So let's go back to seeing you before perimenopause and postmenopause and those issues arising. How early should someone start focusing on their pelvic health and how early should they see you?
Yeah, there's no good answer, right? I think as soon as you decide that you want to just have that quick wellness check, I find that, especially with pelvic floor physical therapy, it should just be like your little check-in, like that you have with your primary care physician or you have your yearly pap smear type of thing, right? But definitely if you're thinking about, if you're having any concerns about what your future may look like in your perimenopause or menopause state, come see me. If you're having any concerns because you want to have a child, come see me. Here, if you're having any concerns about just how to navigate through your sexual function, come see me, right? I don't think there's like an answer where you have to wait till you see this or XYZ. Let's not wait till you have symptoms before you come see me. But I get it. This is the thing. I'm I don't like to scare my patients, right? And I'm not going to have you come to me and then I'm going to find that problem. We're just there to talk about your lifestyle and what things you can do to help enhance it and to help your pelvic floor and help you feel like you're feeling your best self at that point. There are some people who they have gone to other providers, physicians, PTs, chiropractors, or they go to that one session and they suddenly leave feeling broken, right? At the end of the day, my advice to everybody is that if you feel worse after seeing that provider, if you don't feel like your answers are being listened to, if they rush you through that subjective component, then you need to find another provider, right? You need to make sure that they are listening to you and they're not gaslighting your symptoms. And especially when it comes to women's sexuality, that happens all the time. Yeah. And if you're in the postpartum period, same thing, like, oh, I'm having some pain with intercourse. They're like, oh, that's just your hormones. That should just use some lube and drink some wine, right? You're just really stressed out. And then when you get into the perimenopause stage, the hard part is women don't get diagnosed with perimenopause or get help navigated through that. And so I was just talking to some ladies yesterday how they were like, I think I'm going through perimenopause. And the doctor was like, oh, that's not it because you're still very young. You're too young for that. Oh, and wow. She's like, but I'm having so much anxiety. It's like they ran some tests. They're like, you're completely fine. You should just probably see like a therapist. And not to say that she probably shouldn't see a therapist, but also they have to see that there was a medical condition, like her lab values were also declining, but they refused to do lab values for a while, right? And the same thing. She's like, I don't feel like I want to like be intimate with my husband, right? Again, gaslit thinking like, oh, that's just because you're stressed out, and I hear this from other patients. They're like, just drink some wine. right? Relax. You're just probably really stressed out. This is when we need to go see, just change your provider. And I think a lot of men and women don't realize that you can shop around for your provider. The same way you shop around for a car, you can shop around for a provider. And not every provider, just because they might be the specialist on paper, they might not vibe with you, right? And you need to find that person that vibes with you, but also listens to you and takes you seriously and tries. And if they don't know the answer, their answer shouldn't be, well, I can't help you, so I can't see you anymore, type of thing. My answer is, if I can't help you, let me help you find somebody who can. Yeah. And let me help you find that answers, and let me help you navigate the whole medical system, because it's very complicated, to help you find that specialist. And when it comes to pelvic floor symptoms, the thing that I hate the most is I'm all the physician's last resort.
When you should be the first.
When I should be the first.
Yeah.
Right? They're like, oh, I've tried I've gone to this doctor. They put me on this medication. That didn't work. They put me on another medication. That didn't work. They put me on another medication. Then they told me to go to this other physician specialist. They said they couldn't help me. That wasn't their specialist. And then finally, after they've seen 7 specialists, usually that's actually the average of physicians. They did a study on how many physicians people see before they see a pelvic floor physical therapist. Is about 7.
Wow.
Right. And it's like, even if you decide to put, like, someone has a UTI, a recurrent UTI, which happens a lot during perimenopause and menopause, right? Mm-hmm. Recurrent UTIs is a big thing. But during that time that they're on antibiotics, come see me, because now let's also work on your lifestyle, and maybe we need to stretch out your pelvic floor because it's trapping bacteria in there and you're getting UTI symptoms, right? So we can do both. You can have that medical management, and still we can work on ways to mitigate and prevent future UTIs as well.
I mean, you just said so much. Let's talk about the UTIs for a minute.
Yeah.
So many women, like you said, experience UTIs, have never experienced UTIs before. And then all of a sudden it's like, what the is going on?
Exactly.
For example, I never had a UTI in my life. And I got the first one and I started freaking out. Come to find out, oh, this is quite common during menopause. I talk about it. I talk to my GYN about it. I talk to friends about it, and I just talk about it. But however, there are people who will not talk about it, and they suffer in silence. And when they do get help, it is the antibiotics. And then they're on antibiotic because it's recurring. And sometimes I wonder, well, your body on all of these antibiotics can become resistant.
Absolutely.
So, but you're saying something as, I don't know how simple it is, but something like stretching out the uterus can, like you said, mitigate UTIs.
Yeah, a big part too when it comes to mitigating and preventing UTIs, when it comes to recurrent ones, it's also looking at the digestive system, as well as like what nutrients are you lacking? And then also, how's your bowel movements? And bowel movements to me are a big marker for our overall health, right? And when we get to the menopause, perimenopause stages, a depletion in estrogen also is a reduction in our hydration in our colon, right? So estrogen, I'm always thinking water for my muscles, water for my colon. And so when we have more constipation, then we're also having that uneven pH in our entire system. And now you're having more of an imbalanced pH in your whole GI, as well as reproductive system, as well as your genitourinary system. And that can also lead to more things like bacterial vaginosis or UTI. So once we start making sure that you're having a healthy bowel movement that's pain-free, formed, and almost daily, if not multiple times per day, then we also see a reduction in the amount of UTIs that they're having. But other things that we're looking at is how much water the patient is having so that they're having a healthy pH system, as well as are they having carbohydrates, protein, and healthy fat to help keep the pelvic floor happy as well. And all of those nutrients are so necessary to have a healthy system, as well as reducing our UTI symptoms.
Okay, so it's the food that you eat,
Hmm.
it's the exercises for your pelvic floor, and also the conversations that you have with your partner that's going to enhance your
Yeah.
sexual life, your intimacy with your partner also. So what can people do? What can women do to enhance their pelvic floor? Three quick things that they can do.
Absolutely. So the big one is drink a lot of water, have strong butt muscles like your glutes.
Okay, so doing squats help?
Doing squats, lunges, deadlifts, all great for your pelvic floor, not Kegels. They're not the main exercise in my head.
I was going to
But
ask
then the
about
third
that.
part is also working on your diaphragmatic breathing. So Kegels, became like the pelvic floor exercise. But I will tell you, most of my patients have pretty strong pelvic floors. Most women don't know, and even men don't know how to relax the pelvic floor. And that's where things get a lot more symptomatic, is when the pelvic floor is constantly on an on position and contracted versus a relaxed state. And so that's why I say the third part is definitely breathing too, and ensuring that you are taking that diaphragmatic breath to help relax that pelvic floor, because breath and the pelvic floor go hand in hand. We have a pelvic diaphragm actually in our muscles, a set of muscles that create the pelvic diaphragm, but when we also have our regular diaphragm, and they work in conjunction with each other. But if we're always in that stressed out state where we're like breathing through our chest and breathing like this, and it never gives our pelvic floor a chance to relax and to have that break. And so that's why always the third one is going to be breathing. So drink water, get your squats in, and learn how to do some diaphragmatic breaths.
I love how simple those are. I know it's not the only thing that needs to be
Yeah.
done, but at least those are three things that people can start practicing immediately. Are there specific diaphragmatic breathing techniques that people should do, or just any type of diaphragmatic breathing? I love the 4-7-8. Which other ones do you suggest?
I love the 4-7-8 because it really starts to cue in our parasympathetic or our rest and digest system. So it helps allow our muscles to really relax. It helps us focus, gives us relaxation in both our mind and body. But the other simple one for some people who are just kind of new at the whole of breathing is literally just a 360 breathing, and literally just picturing the bottom of your rib cage as a circle.
Yeah.
And with every inhale, that circle is expanding. And with every exhale, the bottom of that circle is closing in. And I like to keep it simple. And that's where we start with, just because sometimes, honestly, the coordination is the hardest. And I have so many patients where when they inhale, their belly goes in. And when they exhale, their belly goes out.
Right.
When it should always be the opposite. When you're inhaling, your belly should be expanding outward. When you're exhaling, it hugs in, right? And that is just that whole stressed out sympathetic nervous system default that we all live in. We're always in this sympathetic state. And so our breathing becomes paradoxical, and we end up not knowing how to breathe. And so once we just work on just like inhale, big belly, exhale, small belly, it changes a whole lot of things for people.
The 4-7, for those of you who are listening and don't know what the 4-7-8 technique is, why don't you just share really quickly what that is and how they do that?
Sure. With the 4-7-8, you're inhaling in for 4 seconds. Then you're going to hold it for 7 seconds. And then you're going to breathe out for 8 seconds. When you started off, doing just like 4 to 5 rounds of that is just honestly enough to help you get to sleep and feel relaxed. And then as you get going, you can progress it to a lot more cycles, moving up to 10 to 12. I find I just do 5 rounds of that, and I just honestly find my state just start to really calm down after a really long day.
I totally agree. It's one of my favorite breathing techniques that I do. Let's talk a little bit about the most effective treatment options for menopausal women experiencing pelvic floor issues, in your opinion.
My most effective, in all honesty, is just education. We don't have enough education. Most males and females, no one, not even the physician, knows enough about the pelvic floor, right? So really just an understanding and having that knowledge is power, right? And so, a lot of women end up just going through the Dr. Google route, and you can go in through this real big spiral of trying to figure out your own symptoms. And then by the end of the day, you're feeling more scared than ever because of every possibility that you could be having every disease known to man at that point, right? And so I find education is the most valuable part that we can have as humans, as patients too, and just having that plan. And so for me, that's how come I love doing telehealth calls with people. No, my hands don't go on you and I'm not working on your soft tissue. I can give you exercises through it, but I'm giving you the peace of mind to know that you're not broken, and B, giving you a plan to help navigate through all of your symptoms and figure out what your next steps could be or should be. Right. Mm-hmm. And so we do a lot of talking, we do a lot of education and a lot of background on things that you are specifically experiencing and things that we can kind of triage, like, oh, that's not too big of a deal right now. Let's focus on this. And I think if we focus on this, it'll also already cure that little bit of like a headache you get or something like, oh, it's, so I help you definitely try to triage through that and help you navigate through your symptoms. And I think that's what every provider should honestly do. But it just kind of gets lost in the woodwork that I think some physicians feel like they have to give you a medication, or a PT or a chiro has to put their hands on you. But we forget the most important piece is just education.
I love that. And I think that's what's missing on the entire menopausal spectrum.
Absolutely.
Education, perimenopause, postmenopause. There's so much we need to know that we don't know. And even talking with you right now, so many pieces of the puzzle are being put together and it makes sense, right? Whereas before, a lot of people will hear a little bit of information here, a little bit there, and it doesn't make any sense. I want to talk to you about access to pelvic floor therapy, because I know some insurance companies do not cover it. And so a lot of women may feel like, oh, well, my insurance is not covering it and I don't have the money to pay for it. I'm just not going to get anything done. Do you accept insurance? Do you know if insurance pays for any of this? Do some insurance companies pay?
Yeah, absolutely. For the most part, insurances will cover pelvic floor physical therapy if they cover physical therapy. We are just another special branch, but there are some insurances who may not cover a pelvic floor physical therapy diagnosis. So there's definitely insurances out there that if I were to put dyspareunia, which means pain with penetration in the vaginal canal, they won't cover that. And it's definitely a struggle, right? And at the end of the day, the other part that I get frustrated with insurance is they also now tell me that we can only do 3 to 6 sessions of this because of this diagnosis. And so they look at a person based on their diagnosis, not based on their entire lifestyle factors. And so they're saying you can only have 3 to 6 sessions. And you can only bill this because that's what we think is right. So I personally, and it's something I've always struggled with, that I don't take insurance. I am a cash-based provider. I do provide super bills if you want to do it, but I get to treat how I want to treat and what I think is best for you based on my education and experience, not because of what an insurance is saying. And with that being said, I work with people of all different socioeconomic backgrounds. The number of sessions we do is based on what your needs are. And so if you're someone who's like, I really want to try this on my own, I just need my plan. Right. I've seen so many people for just one session. And we see one session, here is your plan, here's the educational piece. These are things you need to look out for. We're going to have the most comprehensive single session. And now you have that power and you can take control of yourself. And maybe we'll do a check-in in 6 months or a year. Cool, right? And then I have some people who are like, look, I'm going to give you that, like you're having a lot of pain. Let's work out in 3 to 6 sessions. And then after that, we can work out. We could space it out however we need. And then I have people who are like, I want to see you every week for 3 months. Cool, right? And I work with that kind of plan as well. But at the end of the day, like I said, my most important piece that I want to provide is the tools for you. And whether that be education is or as like diet tools or any sort of self-massage tools. If I can empower you, that's my goal.
Got it. Okay, so let's talk about sex, baby. Let's All right, so two things I have noticed when it comes to sexual intercourse with people who are perimenopausal and menopausal. And I know sometimes this is for people in general who may not even be in perimenopause or menopause. Low libido because of low estrogen, and also painful sex because of muscle issues. Talk to us about that, and how can women navigate this issue because it's so painful? For some, it's embarrassing to talk about. For some, they're embarrassed to talk about it to their partners, but it's something that needs to be addressed.
Yeah. So when it comes to low libido, all of that, it's low estrogen, then coupled also with low testosterone as well. And so making sure that you're seeing a physician who is also a specialist in menopause, so that they can not just run to just giving you topical estrogen or an estrogen pill, and making sure that they're also looking at your testosterone. Maybe you actually need testosterone hormone replacement therapy, right? Or they can, if someone has a significant medical history, then maybe they can just suggest topical estrogen, so they're having more local effects to the pelvic floor, so they're not having pain with intercourse and having more plumpness at the tissue at the pelvic floor. And so then when they come see me, I'm making sure like they're having that conversation with their physician and making sure that they're going through that proper lab work, and I'm helping them learn how to ask for certain tests, or teaching them of things they can try to look out for so that they can talk to their physician about it. And so when they're coming to me about issues with pain with intercourse, we're looking at your whole entire lifestyle. Like, what are your stress levels as well? Are you able to have a good conversation with your partner? Are you able to have an open discussion to let them know, A, I'm having low libido, B, I'm having pain, and I'm scared, right? And I hear this all the time. Like, I'm just really scared to have sex, right? And so having that open discussion is going to be like first and foremost for all of it. And then in terms of the pelvic floor physical therapy stuff, I'm doing that assessment. Are you able to have your pelvic floor relax for intercourse, right? Because that's kind of what should be happening, is the pelvic floor should be nice and relaxed, right? It gets engorged during arousal, things like that. But at the end of the day, they shouldn't be in a constant Kegel state, which is why I say Kegels aren't the best exercises, because we don't want the pelvic floor muscles always on. Right. So are they able to kind of relax that? And so now I'm teaching them how to relax their pelvic floor. I'm going through exercises, how to relax their pelvic floor. But we're also looking at their posture. If they're constantly like slouched forward, and this is how they hang out all the time with like a hunched back and at their desk all the time, that can cause stiffness at the back, which also can cause pain during all fours position of intercourse, right? So now we're looking at you orthopedically, how we can try to help and work on different positions that that can help you have a more satisfying and enjoyable sex life, right? But then there's also tools you can use. There's a pelvic floor wand that helps stretch out the pelvic floor muscles. I'm stretching out the pelvic floor muscles with my finger. I'm teaching you how to stretch out the pelvic floor muscles with your own finger. But they also have a tool called the O-nut that if you have penetrative sex, and that's the type of sexual enjoyment you enjoy, then there's an O-nut where it literally goes over the shaft of the penis or any sort of sex toy or anything like that to help prevent the tool or the penis to go too deep and cause any discomfort. So there's so many different tools that people are not aware of. So I'm there to also make sure to let you know, like, hey, look, you're not alone. There's a tool because it hurts when they go too deep. So here's a tool to prevent it from going too deep. And now you don't have to think about it, and you can just have an enjoyable moment, right? So it's really, again, like goes back to the educational piece, the listening piece to working with people who are having pain or even trouble with orgasming. That's actually a big one too, right? In perimenopause and menopause, women in general don't realize that having difficulty having an orgasm can be a pelvic floor symptom. right? So
Wow.
tightness at the pelvic floor can prevent the clitoris from filling up with all the blood and things that we need to have an orgasm. Tightness at the pelvic floor can also reduce the sensitivity at our clitoral hood and at our clitoris, so that you're not they're having trouble having an orgasm. So, but women don't realize that that's a symptom, because in our society, it's not about the women's orgasm. It's about the man finishing.
Exactly.
Right. And so we don't think that's even something we need to talk to our physician about, because that's just, maybe I'm just getting older. Maybe I'm just stressed out. Right. Like, so maybe that's why I'm having trouble having an orgasm. It just happens with life. And so we don't even think that's a symptom of pelvic floor. So that's also another question that I'm asking outright, is how your orgasms are. I'm always prefacing it. I'm sorry, this is going to be an uncomfortable convo for you, but we're going to go really into it. And I want you to feel comfortable to talk to me about that.
Right. I love the depth of the conversation, because it's so necessary. You know, I think of all that women have heard about sex, and this idea that we should not be sexual beings as we get older is something that's been passed down, and it's been tied to aging. It's like aging is unattractive. You shouldn't be doing things like that. And people literally buy into that. And deep down inside, they don't want to live like that, but don't know what to do about it.
Absolutely.
And then we have these solutions that they're unaware of. Honey, we need school. You need like a whole master class. How do you empower patients to take an active role in managing their pelvic floor health, specifically during menopause?
100% is just being more body aware, understanding where their pelvic floor is, what state it's in when they're just doing everyday activities. And it always comes down to our nervous system, and are we in a constant fight or flight mode? And so I want people to realize that their pelvic floor exists, and also what state it's in. And the biggest win that I see in their second visit is like, I was really aware that I was like holding my pelvic floor really tight the whole time. I was like kegeling the whole time, and I had to actively release that and let go and do some breathing. And then I actually felt it relax. And they start to beat themselves like, I'm sorry, I had to keep doing that all the time, and I just needed to relax already. I'm like, look, the first step is recognizing it. I think it's amazing now that you actually know where your pelvic floor is and if it's being relaxed or contracted. And so I think that is actually the biggest thing that I could say for any person going through perimenopause and menopause, is to know where your pelvic floor is. Also, the second part is to actually look at your vulva in the mirror.
That's a big one.
And that's a big one, right? That's a big one. Most women, look, I hear it all the time. They've had a baby or they get older. They're like, I don't ever want to look down there. I have no idea what it looks like. And I get it. This could actually be a very traumatic thing for some people. It can mean a lot of different things for them. So sometimes, like I have someone who's gone through a lot of sexual trauma. She can't look at her pelvic floor, let alone like touch it or anything. So we're starting off very slow. I'm having her do things like over the clothes, things like that, just so that she could be more comfortable with her own pelvic floor and her own sexuality. But we work our way up. If it's very empowering for you to be like, that's my vulva and that's normal for me, right? And unfortunately with porn, people think vulvas are supposed to look like this beautiful like shape and whatever. A lot of that's like AI generated. It's fake. All vulvas are beautiful and they all look completely different. A big part is it also comes to a medical standpoint that there are certain conditions and diseases that can happen at our pelvic floor. Something specific I'm thinking of is lichen sclerosis, where you have like a dry patch, and it just starts off with like a dry patch and it turns into complete pain at the pelvic floor. But that diagnosis is very hard to diagnose because most women don't look at their pelvic floor. They don't see that patch, right? That whitening patch. They don't see the signs because they haven't seen what their pelvic floor looks at baseline. And then they never look at their pelvic floor later on. So they don't notice these changes. And so if you look at your pelvic floor early on, then you can see what changes, and you can actually talk to your doctor or your pelvic floor physical therapist who's like, look, I'm now noticing my tissue's thinner, or I'm noticing my labia is now possible that it can now merge with like the other part of your labia, the two parts of the labia minora and majora can connect, and that's another condition, right? So I want women to do it on a medical standpoint so they understand what changes are happening, but also an empowering standpoint, because I want women to realize that their own vulvas are beautiful too. And I think that's a big part of having a healthy sex life as well.
You know, I'm thinking it feels like mirror works for the vagina. And the thing is, so many women have an issue even looking at their faces in the mirror as they get older.
Yeah.
And so I could just imagine how hard it is to look down there. I know for me, it was at first, it was very uncomfortable, but I love the idea of looking at it younger, because I didn't when I was younger, never did. It's only as I got older, I started taking the initiative too, because someone said it. And I was like, oh my God, I need to do that. At least, like you said, you have a baseline. Most people don't know what they're looking for. And so they're like, oh, well, maybe it was like this all the time.
Right.
Get a mirror? Should we?
Absolutely, right? Like,
label it the vaginal mirror.
And you can do it, like, think of if it makes you uncomfortable, think of it in a medical standpoint too. You know, you can have a diagram printed out of like a vulva and be like, oh, this is my labia. Oh, this is my clitoris. Right. Oh, this is my introitus, or the vaginal opening, you know. So then you can kind of take away a little bit more of that, maybe that discomfort that you may have, because it's a very sacred and sexual part of you, but it's also a part of you that is also muscles and tissue and things that we should be aware of. Like maybe there's a new mole there and we should probably check out that new mole, things like that. Right.
Right. You know, I think this should be part of sex ed.
Absolutely.
You know, people go through medical school and it's not a core part of what they're learning in terms of how are we going to support these women as they age, as they go through yet another transition. It's not the same as pregnancy and puberty, but it is just as important and impactful in their lives. How can we support them?
Absolutely.
Yeah. So what is the role of personalized physical therapy for women going through menopause?
When it comes to menopause in general, no two women have the same symptoms. Some women, you know, the whole idea is hot flashes. Some women have no hot flashes, they have insomnia. And it's the same thing when it comes to pelvic floor physical therapy. It's so crucial for me to see what your posture is like, what exercises you do or don't do, what your strength is, because that is going to help create that individualized plan. Maybe you do have a very relaxed pelvic floor, but you have very weak glutes. Or maybe you have really strong glutes, but your breathing is off. So we have to constantly look at that. But then also, I'm also looking at your lifestyle too. Like, are you still working right now? And is your exercise plan going to allow you to have a really long plan? Or are you really busy? So now I'm going to just really make you a condensed plan for you, and also see what we can do to make it easier and give you more attainable goals. Also, some women have different goals when it comes to physical therapy. And even though maybe I don't love that, like I hear that they have maybe some lower back pain, right? And I hear this a lot where they're like, oh, I have some pain, but I don't want to worry about that. I'd rather just worry about, let's say, you know, like incontinence or something like that. Then we work on that. Whereas someone's like, I need you to, you know, fix everything. Then we're going to create a plan to work on all of the deficits that we find. So I really want to make sure that every person is feeling heard, and also that I'm creating a plan that can also fit their lifestyle as well.
No, you're doing all of this amazing work. You're taking care of others. How do you take care of yourself? 3 self-care rituals that supports your well-being.
So my self-care ritual is always exercise. I'm always looking at fitting exercise as much as I can into my lifestyle, even if it means just a few stretches, or sometimes I can squeeze in a whole hour. But I even block off in my own patient schedule a time that I can actually go to the gym and exercise, because I find the quickest way to change your mood is through movement. And so that's why I'm always squeezing in movement. And physical therapy can be especially pelvic floor, can be a very emotional job, just because I hear people's traumas as well. So it's a good way of just kind of decompressing as well. The second thing that I do is spend as much time with my family as I can, especially my little son, he's going to be 4 and he acts like a pirate every single day. And so just being with him helps decompress me as well. And it's also part of that self-care. So I surround myself as much as I can with positive people and being around people that bring light to my life. And then the third part is drinking water. I'm always drinking water, right? And so, and I think those are going to be my best self-care. I'd love to say that I really want to get into meditation. I really want to get back into yoga, and I want those to be part of my self-care routines. Right. Just at this point in my life, I'm still working on that. But as long as I can try to get my water in my life and a lot of happy pirate laughs and exercise, and I feel really good.
Sounds like the perfect combination. The pirate laugh got to be in there.
Oh my God, he's such a funny boy.
Oh, that's so sweet. One thing I wanted to ask you, what advancements in pelvic health are you excited about and other women that are excited about?
There's that medication coming out now to work with low libido, and they call it almost like the women's Viagra. It's being talked about. I always get wary in terms of new medications and things like that, right? So I'm not going to be the first one to jump on that bandwagon and be like, oh, everyone take this magic pill, because I don't think that's, I think it's always too soon and we need to kind of figure that out. But I'm excited for it. That means now we're starting. Of course, it's 2024 and we're just starting to think about this, and they've had Viagra for how long now?
Oh my gosh.
But I'm happy for it. I'm happy to see that there is a little bit more talk about it. And I hope to see more discussion on women's sexuality. And I just want it to be more research. We need more research on just the female body in general.
Absolutely. I totally agree. Thank you for that. One last question before you go. It's the hypothetical question I ask some version or the other to my guests. If you were a relationship therapist, what recommendations would you give to a couple in their 40s about fortifying their sex lives, and why?
100% is have a good conversation about what your needs are individually and how you can work together as a couple to do that. And just know that conversation should be fluid and evolving, because we all change day to day and as we progress through our life. And so the first step is recognizing your own pleasure zones, and then talking about where your partner's pleasure zones are, and then seeing how you guys can help each other during that. And it all comes down to that communication, right? Can you have an open and free, judgment-free conversation, and then also not being afraid to spice things up if you want, right? And so understanding that maybe you like something back in your 20s together, but you don't like it now. Or maybe you saw something, you want to try it now, right? And that's okay. And to understand that sexuality is so fluid, and that you need to have that continuous conversation on what kind of drives you and what arouses you, what excites you, I think is just super crucial for every couple.
Yeah. So it is, I feel, the foundation of all of it, the conversation, and also releasing the shame, right?
Yeah, exactly. Releasing the shame. That's 100%.
Yeah. I love that. Thank you. Melanie, what do you have going on? What good things, what new things do you have happening with your medical service, with your Best Self Wellness Center? Tell us more.
I opened my clinic here in Jersey City, New Jersey, just a few weeks ago. So I'm excited. Thank you. So that's been my biggest move. I was doing all in-home prior to that, but now I've opened up my clinic. I'm seeing women and men now. So I, for a while, was not seeing men because I was doing all in-home, but now I'm back to seeing men for pelvic health as well in the clinic. So I'm just really excited to be able to extend my services to the more general population as well.
Please follow Melanie. She's going to tell us where we can find her and stay connected with her because she is a wealth of knowledge and a breath of fresh air and just knows the things, so much of what we need to know. I mean, and I need to bring her back so we can talk about this a little bit deeper on a different level. So tell us how we can stay connected and where we can find you.
Absolutely. So you can go on my Instagram. I'm on bestselfwellness.pt. And you can also just email me right at bestselfwellnesspt@gmail.com to get any more information.
Thank you so much for taking the time out of your schedule to come and chat with me and chat with the audience, of course. Melanie, thank you so much. I appreciate it.
Thank you so much, Dixie, for having me.
You're welcome. And listeners, thank you for leaning in. I appreciate you. Let's perimenopause and prosper, and I will see you next time. Bye.